The CTO and LV support session started by us recognizing that all of the evidence that we have, though helpful, doesn't answer the entire question. We have to think very carefully about the patients that we choose to bring forward for CTO revascularization, particularly when their LVs are dysfunctional. We recognize that trials homogenize patients, and there are all kinds of unmeasured confounders that mean we have to think very carefully when we select patients for these procedures to make sure that we're picking the ones who are likely to benefit, and at the same time making sure that we do everything we can to risk mitigate, to reduce the likelihood of patients having adverse events from these procedures, so the balance of the clinical effect ends up being in the camp of the benefit they'll get from a complete revascularization that's performed safely. So in that process, we learn that we've got to use hemodynamics to risk mitigate. We need to know where our patients are along their functional continuum so that we can keep them or bring them to a place where they are safest to undergo a complex procedure, and to recognize those patients that maybe need a little bit of extra support, in this case hemodynamic support, to get them through these complex procedures. And then we learned a bunch of technical strategies that we can use within the CTO realm on how to perform the CTO, how to plan the CTO, how to engage our team members to ensure that ultimately we take these patients from where they are at their baselines, unwell and need of help, to their best, recovered and feeling better.